All right. Good afternoon, everybody. I just have a few items to go through and then happy to take any questions. With the new influx of travelers arriving to Lackland from the Diamond Princess this weekend, the city initiated discussions with our federal partners to test and monitor travelers exclusively at Lackland Air Force Base and to keep travelers at Lackland until the test results from the CDC are confirmed. Reason for this are twofold. One is we ensure there's zero exposure to the general public as long as travelers can stay isolated at Lackland. And also, when any travelers are presenting symptoms, we keep them at Lackland until test results are confirmed. So we don't reach capacity, we don't test capacity at the other local facilities that are here, state and local facilities. So the more that we can keep the activity at Lackland, the better in order not to overwhelm existing local facilities. To date, there's still only one confirmed case of COVID-19 in San Antonio, and the threat to the general public remains very low. My most recent conference call with CDC took place yesterday, and we do have daily communications with our federal and state partners in this protocol as we move forward and chart the best course to see the end of this outbreak. Couple other
19. What are your thoughts on Judge Wolf reaching out to Chipori and asking him to keep people at Lackland, not take them to the hospitals?
So those are the requests that we made of our federal partners over the weekend. It's something that we continue to reiterate with the CDC as well as DOD. So we've been in the loop. I have daily communications with our federal partners. In fact, we are going to be talking with members of our federal delegation again tomorrow, and look forward to continuing to make that case. The issue for doing that is twofold. One is we ensure that there's zero risk of exposure as long as we can keep operations at Lackland. The reasons are twofold. One is we can ensure there's zero exposure to the public as long as we can keep the travelers and all of the health operations at Lackland. And two, when there is someone present with symptoms that may or may not mean infection with COVID, we want to ensure that we're not taking capacity away from local and state facilities that would be used to ensure treatment of people who actually turn up to be positive with COVID-19.
Also, the Texas Center for Infectious Disease says that the state's tuberculosis treatment facility in San Antonio could potentially be used for that as well?
It's currently being used.
Okay.
So that is the first stage hospital treatment facility that would provide isolated treatment for anyone present with symptoms or a positive with the virus.
That's where that one patient is right now.
So the first patient that was present last week when we had the press conference was before the TCID facility was made available. So that patient was treated, has been treated at That patient has been treated at Methodist. The first patient that we spoke about last week that was turned up positive with COVID-19, the one that we had the press conference about, was transported and has been treated at Methodist Texan Hospital. That remains the case. It was before the TCID facility was made available. But now that we have the TCID facility that's made available, it's in an isolated location. This has a number of beds available with the right protocols established by CDC that can manage additional cases.
Why not just keep the patients on the base in the first place rather than bring them out into community hospitals?
That's the exact question we've been asking DOD and CDC since the weekend.
But Metro Health was the one who initially identified local hospitals for them to bring it where they could bring patients. So why was that not a concern earlier?
It's all part of the standard protocol. So we have to assist with how we treat the patients in terms of finding capacity. But we've been making the case for CDC and DOD to establish protocol that would keep them at the DOD facility through as much of the process as possible.
I guess the question, though, is why is that just now a consideration?
It's not just now a consideration. We've been communicating that with CDC and the DOD since the weekend.
No, but I mean, before the first evacuees arrived, that did not seem to be considered. It's been since this weekend. We've been preparing for longer than that.
Well, we've been in communication with CDC since before the evacuees arrived on protocol, but I can tell you that my office has been part of that communication since the weekend, asking for the protocol to be established that we have those patients at DOD facilities.
And could you speak to, I guess, what's the city's role in all of this? I know the CDC is doing what they're
Yeah.
doing. What is the city's role specifically?
The city's role is to basically act as a partner in the process of bringing Americans back for evacuee preparations and treatment, and that's exactly what we've been doing, and the process has worked perfectly. We are working to perfect the protocol, but I will tell you that between the CDC, Metro Health, the county, and the state partners that have been involved, we've ensured that the public has not been exposed to any risks of potential infection, and we've ensured that these Americans who turn up, in this case one positive, is getting the best treatment available. We have to ensure, number one, that our public is safe. We've been doing that. And number two, we have to ensure that those who need treatment get it, and get it in a safe manner, and that's exactly what we've been doing.
In your last conversation with the CDC, I believe you said that was yesterday.
Yeah.
I know, well, last week when I spoke to them, there was a potential that those first people who were brought in could be cleared to leave by tomorrow. Any word, did they mention if those people would be able to leave, or will they be leaving on tomorrow, or how would that work?
So we have to get an update from CDC on that, because that is a fluid situation, and we have to get an update from CDC about that.
Okay. Would we get information on that possibly today or tomorrow?
Yeah, I mean, we have daily phone calls with them, and in-person meetings, as the case may be, with Metro Health and CDC, so we can get that information to you.
So to your knowledge, the people that were there first, they're the ones that because February 20th was the CDC's date, that's their 14-day period. To your knowledge, is it only those 97 people that were brought there first? Are they the ones who are, if they're let go tomorrow, are those the only ones that are going to be let go?
Only the ones that are finished with their quarantine protocol would ever be released, because again, the protocol of the quarantine for all evacuees arriving was established for the best precautions against any kind of exposure. And so if the quarantine period is not finished, no one's going to be released.
Any word on any San Antonio residents who may need help getting evacuated, or is trying to come home from China or any other places?
The only evacuees that we've received have been from the first cohort that arrived by plane from the Hubei province, and then the second that we received on Monday that were evacuated from the cruise ship.
Have any of your patients been transported to the Center for Infectious Disease?
We've had, what is the number, Bruce? We'll have to get that number from CDC. At this point, we have only one positive case, and that was the one we discussed last week.
Would you say that, I guess, the CDC has been doing pretty well in communicating with the city? Because I know we've been trying to get in contact, and I understand that they probably have so much on their plate, which we understand, but we haven't gotten much information as well, you know. Has the communication between the city and the CDC been pretty well?
The communication has been constant with CDC and Metro Health. Our challenge is we want to make sure that we have a better protocol with regard to the travelers at the Lackland facility, and making sure they're not unnecessarily transporting when they're not positive, so we don't overwhelm local and state facilities.
Has DOD or CDC explained why JVSA Lackland was chosen as one of the quarantine sites over other military installations?
We know we were one of the four, and the four were selected based on their capacity to provide care in a safe manner, and that's not a surprise for anyone who knows our role in disaster preparedness and responding to emergencies. San Antonio, our military medical complex, has taken pride in being one of the best when it comes to responding to disasters and emergencies and to protecting American lives. That's what we have done from day one. That's what we'll continue to do. And while we do that, we also ensure that we have the best precautions taken against outbreak or consequence to the general public.
But do we really have that capacity if the original plan called for taking the patients who did have the virus or were suspected to have the virus and treating them at local facilities? Do the base really have that kind of capacity then if they weren't able to be treated on the base?
Yes, they do. And in this case, we're talking about protocol established between CDC and the Defense Department. And that's what we're trying to ensure changes to the best it can to protect the general public here in San Antonio. That's what we're pushing to do. But in terms of the capacity for us to handle this situation, we have that. That's why we're performing as well as we are.